thank you for joining us on Chennai International Centre's podcast series on COVID-19 second wave. You are listening to episode 2, where Dr. Jaiprakash Mulil, India's top epidemiologist, will address questions from our listeners on variants, tests and vaccines. One of the most commonly asked questions is, how different is India's second wave from the first? Is this wave more infectious and manifesting in symptoms that are different from the earlier mutant? Dr. Mulil, could you please answer this for our listeners?
First of all, we should remember that mutation is an inevitable occurrence in all viruses. And fortunately, most of the mutations are of no serious consequence. But you got to watch out. And the three things you suggested, does it make the infectivity more? Second thing you suggested, does it make the outcome more dangerous? That is, does it increase the fatality rate? And does the clinical picture on the whole become more dangerous? And the third is in terms of whether it is arrogant enough to ignore the immunity some of us have already received from earlier exposure to coronavirus. So these three questions is something we have to clearly be concerned about. Now, from the nature of the viruses that we have, and we have been doing genomic typing recently, we know there's one thing that has changed quite a lot from the earlier earlier part of the epidemic, that this seems to be more catchy in the sense that we think its reproductive number may be a little high. And this will translate into our herd immunity going up a little bit more higher level that is required to stop the epidemic on its track. So, of course, we have the same there, the hidden question, are the vaccines going to be useful in preventing it? Now let's take one at a time in this thing of clinical picture. We are still gathering data on clinical picture. Now, there are anecdotal information which you should be very cautious of. There is a report of a child there falling sick, or a young person falling ill, or these things have to be analyzed carefully. And this data have to come and ask the question in terms of mortality. Now, the virus that we had earlier had a very, very low mortality. And people don't believe Indian data. And very many people claim that there's a lot of suppression of information in Indian context. In fact, initially I too thought that many of these things are hidden. But now I am convinced of looking at the information from various centers where the data is good, and also compared to the expectation based on European data, there is definitely a lower mortality. I'm agreeing that there's some amount of suppression of information, but that doesn't explain the huge difference in mortality India has compared to Western data. So even now with the new variant, it is not too worrying in that context. So it is more infectious, but not truly more virulent so far. So the third question, if it is a person, if the new variant can reinfect previously infected people, then we have to go through the whole process again. Because we have probably several crores of people who have been already infected with the previous virus. The point is, that happened. You will find exactly the same people who got it infected first now getting infected again. That's not happening. There are a few reinfections, but not enough to declare that it is an immunity escape mutant. A mutant that escapes the earlier invariants. From the same argument, we can safely assume that the vaccine that we already have should take care of most of the current variants. There have been laboratory studies looking at the behavior of these variants in the context of RT-PCR, and every one of them variants are stimulating human T cells who are known to have had previous infection with coronavirus. So from that point of view, we are not concerned whether the variant will be, more dangerous. So it is, these variants have made the spread of the disease much more rapid. Now, we can now comfortably say that those who are infected previously with coronavirus have long-lasting immunity, because even in the presence of this wave, they have been reasonably protected. You may be able to point out there are 2 cases there or 1 case here, but that's not the way the whole game works out. You have to clearly demonstrate that clearly there is excess reinfection among the previously infected. That has not happened.
Thank you, Doctor. Let us all hope that this variant that is more infectious but not as virulent turns the tide in a positive direction towards improving herd immunity in addition to the vaccination efforts. The next question from our listeners is around the accuracy of RT-PCR tests, specifically in detecting the mutant variants. What are the chances of getting false negatives and false positives?
Yes, RT-PCR that we currently use is an excellent test in terms of diagnosing presence of COVID virus in a person. Remember, when we started the game, we had a test which was only about 70% sensitive. That means there will be 30% false negatives. The new test is excellent in picking up disease ones, that is those with the infection. So the sensitivity is near 100%. Why I said near 100%? Because in some cases, the virus disappears where the clinical features lingers on. In those situations, even though clinically it is COVID, you may find the virus is not being picked up by the test. So that means occasionally you may get a false negative. However, the more interesting problem for COVID, RT-PCR, is the fact that it can give you false positives. That is, in the absence of any virus, it will tell you positive test. And why does that happen? That is the nature of all tests. When a test becomes very highly positive, very highly sensitive, it loses a bit of its specificity. Lack of specificity leads to the formation of false positive cases. And in the case of RT-PCR, it is supposed to be about 0.5%. No, in these sort of situations, it doesn't hurt much. But as the disease is disappearing, when you continue to do large number of RT-PCR tests, you may be having half your cases as false positive. So you have to watch out as the disappeared cases are dwindling in number, which will happen soon enough. So this particular question, whether RT-PCR, the same test, is useful for all the variants, the answer is clearly yes. They pick up exactly the same way. the virus as in the case of old. When you have a large number of clinical cases, you may start seeing false negatives and false positives. That is inevitable. And that is biologically also a possible scenario. I explained to you how virus disappears as the clinical disease progresses. Okay? Over a period of time, the virus disappears, and those who reach hospital late may have florid clinical signs and symptoms, but the virus might have already disappeared from the body because of the body's immune reaction. So that way, you get false negatives. And so both these are normal in all medical tests. Small percentage of false positive and small percentage of false negative.
So that leads us to the next question, Dr. Mulil, on the latest CSIR survey that suggests lack of meaningful antibodies in seropositive people. Now, could you help put all this in perspective for our listeners?
The way the coronavirus protects a long time is through stimulating our type of cells called long-lasting T cells and long-lasting B cells. These are really the key to our immunity. In fact, early studies with this have shown that even in the absence of antibody, our T cells are able to respond when exposed once to a lasting immunity. And in fact, antibody levels, remember when you do a test for antibody, there are many options. In fact, corona infection produces more than 22 antibodies because different parts of the virus allows antibodies to build. Now, the body immediately looks at this antigen and produces antibody quickly. And then it evaluates each of these antibodies and how it is functioning. Okay? And chooses the best one. And usually it chooses the one that is the spike protein based antibody. And nurtures it and asks other antibodies to shut up. The one that is used normally in testing is an antibody for the nucleocapsid. That is not really involved in defense, but is very useful for diagnosis of corona infection in the recent past. So the lasting immunity is actually a function of the T cell, and there are tests for it. Unfortunately, these tests are not easy to do. So we can't do it and see how many people in India are positive with T cell. No, that is impractical. However, the more important evidence comes from these areas where it was rampant COVID going on and this what you call urban slum, where it has gone up and come down. They are holding on. Clinical evidence is the best evidence in the context of this particular relevance of antibody. So antibodies may come down. Now what happens is either the vaccine or the natural infection trains the T cell to fight against coronavirus. Anytime coronavirus comes in, T cell moves in. So that ability, at the moment, I believe, is a long-lasting benefit from a natural infection. I hope even a vaccine can give you long-lasting immunity. I have no evidence for that now. Okay? So, we are dealing with a virus which is capable of giving you, through natural infection, very long-lasting immunity. That is in our credit.
So that brings us to the last question in the episode, and this is about children. Our listeners would like to know if the new variant affects children and youngsters more, and if there is any information on the long-term effects in children.
Yeah, that agreed. The only saving grace of the corona epidemic was it did not seriously affect children. Most of them walked over corona without any fear and consequences. Now, there are always exceptions. There are always some getting. Now remember, we have 36 crores children in India, and this virus is going through. Now, how many may get infected? Or quite a few, because it's a family infection. You can't prevent it. But how many will get sick? Our expectation of death is less than 1 per 100,000. Less than 1 per 100,000. So, we are anxiously watching how this is panning out. If that is not a serious thing, and we have centers in India which are specially looking at children and the way they deal with infection. And till now, there are no evidence that it is dangerous. Remember, the total number of cases highest we reached was 96,000 per day. Today, it has crossed 300,000. So naturally, the infection is greater. So more children are getting infected. So there will be a few who get into trouble. Let's hope and pray that these are all exceptions and not a rule.
That brings us to the end of episode 2, where Dr. Mulil answered questions on variants, tests, and vaccines. Coming up next is all about vaccines. Do tune in to episode 3 for more.